Good morning, everyone. My name is Maya Luria, and I am thrilled to have Dr. Gulshan Sethi here with me today. We are talking this month all about our emotional and mental health. And this has been something that has been a huge topic for everyone. And what I love about Dr. Sethi is that he brings in laughter therapy. And so that's sort of a fun new angle that we can use for a tool for stress management. I want to give you a little bit of background about Dr. Sethi. He specializes in cardiothoracic surgery, and his primary interest has always been coronary artery bypass surgery and valvular surgery. And he is retired from practice. He was the chair over at Tucson Medical Center. So I am thrilled to have you here today. Thank you for being here, Dr. Sethi.
Thank you, Maya, very much, and welcome everyone. Thank you for inviting me to give a lecture for TMC, our senior. So this morning, the lecture will be in two parts. The first part is a PowerPoint, will be followed by a laughter session. So as you can see on the slide, I used to be heart surgeon and used to be clown. I'm still clown, but not active heart surgeon. So talking about mental health, Maya is so right. During this COVID pandemic, the lockdown, the inflammation of a brain, it has caused havoc. And there is increasing evidence that many patients, as much as 43% or more than 40% of the population is having a symptoms of anxiety or depression. This could be because of the pre-existing condition or a new condition. And this represents some of the slides, what we all go through when we have depression or anxiety. So what we need to do is to protect our mental health during this time, not only during this time, but all the time during our lifetime. Maya just told me that she heard yesterday that laughter might be even good for prevention of Alzheimer. And there is a data available from Australia that it is a prevention for dementia. So laughter plays a very important part in protecting our mental health. So what is the stress? The stress is the emotional response to a stimuli, and it can cause various responses. The most common are anxiety or depression. The person may feel overwhelmed. She or he may withdraw from the social activity. And the worst thing is that the stress is either the primary cause or aggravating cause of most of the diseases. It affects all parts of body, not only brain, but it affects cardiovascular system, skin. People develop blisters, dry nails. It can affect the joints, painful joints. It can affect the gut. People develop diarrhea, constipation. Your immune system is compromised. And something which we did not know for some time, that it can affect your reproductive system also. The men and women who are stressed, they may not have enough sperms and they have difficulty getting pregnant. The women have a difficulty getting pregnant. So what can we do for stress? There are many things we can do. One thing is we can go to our doctors and ask them to give us some medication. And over 50% of our population is using some kind of medication to help us with our anxiety or depression. Or we can activate our own body responses, excuse me, And these include breathing exercises, meditation, yoga, and the list goes on. I will talk about laughter therapy today. And laughter therapy contains the top part intervention, which includes breathing, meditation, yoga, aerobic exercises, and guided imagery. Now, we don't have to use all of them. These are tools which are given to you and to us. We can choose what we want to choose, which makes you happy, with you are comfortable. You may like music therapy, or painting. Right now I'm retired, and I'm using painting to reduce my stress. And I'm started learning how to play drums. So you don't have to use all of them. Just pick and choose what is best for you. So laughter is not something which is new. Excuse me. It is described in Bible. A merry heart does good like medicine, but a broken spirit does the bones. But to get rid of stress, it takes time. You cannot just say, okay, I want to be de-stressed. It is something you have to pay attention to, something you have to work on. Here's the cartoon saying that I'm learning how to relax, doctor, but I want to be the cutting edge of relaxation. Unfortunately, all the interventions we have got, they take time, like breathing, meditation. So I show this slide because this is Thomas Sydenham is considered the founder of modern clinical medicine. About 400 years ago, he said, the arrival in town of a good clown is of more benefit than the arrival of 20 asses laden with medicine. 400 years have passed, and now we are still talking about the benefit of laughter. So what is the laughter therapy? It is a newer form of exercise which integrates breathing and stretching exercises with humorous pantomimes designed to provoke and enhance laughter. And when we do this in a willing group, it encourages a playful, imitate laughter, and this imitated laughter then turns into a spontaneous laughter. Unfortunately, on the video, on the Zoom, we can't do that, but we'll try to do our best we can. This is a small blip from Chopra, very well known Deepak Chopra's newsletter, which he talks about 6 reasons why laughter is the best medicine. And he mentions some of the work which I have done. And here is Dr. Andrew Weil talks about laughter. He also says that I've heard the phrase laughter is the best medicine, and I've heard the laughter can benefit health. So there are physical, mental benefit of laughter. It lowers the stress hormones, boosts immunity, decreases pain by releasing endorphins. It increases the heart rate variability. It dilates your blood vessel. And there is a data to suggest the patient who had a heart attacks, if they are treated along with the physical therapy with laughter, they have a less recurrence of the heart problem. We all know the social benefit of laughter. It strengthens the relationship. It attracts others to us. When we are talking and laughing, other people want to find out, what's going on there. Can we join you here? It enhances teamwork. In Japan, in many factories, they have when they go to work for first few minutes, they do the laughter yoga, laughter exercise, and it brings the people together. It promotes bonding. And now this is the thing which we want to talk today, the mental health benefit of laughter. It adds joy and zest to life. Once you laugh, you feel good. You feel like it reduces the anxiety, reduces the tension, relieves the stress, and your mood becomes better. Uh, when I am not feeling good or blue, I will just go uh, 10, 15 minutes uh, away in a place where I can just sit and laugh. And I'll show you how you can do that. There is a data to suggest that it reduces depression. Um, for a mild to moderate depression, laughter therapy may be as good as taking the medicine, and no side effects of medicine. It reduces agitation, as I mentioned earlier. Uh, Patients with dementia, they get agitated, and I used to practice with this with my father-in-law when he was close to 100-year-old, and when he got agitated, I will just sit down and do some laughter with him, and I'll show you how we did that. And the final thing is that it makes you more resilient, which is a very important part of our life. So how does laughter work? It is a mostly expiration. It's like this. It's all expiration. So you get rid of residual air, you get rid of carbon dioxide, you get more oxygen coming to your cells, your RBCs, they feel so happy that more oxygen is coming. They're jumping around, going all over the place, flushing your brain, getting more air to your brain. And it decreases moisture in the bronchial tree. And there is some data to suggest that if that happens, then there is less chances of developing lung infections. So that's such a simple thing to do. Laugh few times a day, you will have a less infections. So it's okay to say, you should do the laughter therapy, you should laugh. But if one person has got a chronic illness, when the person has got cancer or they are depressed, it is difficult for them to laugh through the intellectual stimuli, such as jokes or humorous videos. Actually, if they're depressed, they don't want to, they don't have the concentration to read books, read joke books, or listen to your jokes. So laughter therapy is a non-intellectual path to laughter. So the laughter is the exercise which can be easily done regardless of your mood. If you're depressed, anxious, not feeling good, you have pain, it can be done without anything. You just have to laugh. So what can you do to create opportunity to laugh? You watch TV, funny movies, read comic books, go to comedy clubs, and talk to the funny people. During this COVID, people have been isolated, watching all this shows which are full of crime and gun violence. We should not be doing that. We should be watching funny shows, make time for fun activities, and do volunteer or social activities. So there are 4 components of laughter therapy. The first is the stretching and breathing exercises. Second is the clapping, chanting, and body movements. So when we clap, we don't clap like this. We clap like this. This we do because there are acupressures on our fingers, and they stimulate the internal organs. With that, we say, we have a chanting, ha, ha, ho, 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 ha, ha, ho, ho, ho. And then we move a little bit, which will we do in just a few minutes. So the first component is the stretching and breathing. Second is the chanting, body movements. And then we will have some laughter exercises, which I'll do with you. And finally, for a couple of minutes, we'll do some meditation. So for good health, exercise regularly, eat right, laugh a few times a day. So there's some guidelines for laughter therapy. First is that give yourself permission to laugh. Be playful. Visualize that you are a child. Laugh unconditionally. There's no joke. There's no reason to laugh. Fake it till you make it. When you are laughing, you have eye contact. So the laughter is contagious. So when you have eye contact, then the other person laughs. During this exercise, we don't talk. You can say gibberish or whatever it is, but no talk which makes sense, because then you have to think, and we don't want to think. And finally, be gentle with yourself. If you get tired, then just sit down and don't get hurt. And we live in Tucson, so stay hydrated. So with that, we'll start some exercises. So are we ready for that?
I'm happy to do that. So let me know, how do you want to do this, Dr. Sethi?
So here it's we're going to start with the first will be deep breathing and stretching. All right. So I will show one time, and then we all do a couple of 3 times. Okay. You can see me.
Mm-hmm.
Take a deep breath. Deep breath in. Let it go. Put your hands up. So laughter therapy exercise is like a warm-up. So this is a warm-up period. So I want you to stretch your hand up like this. Take a deep breath in and bring it back to you, Maya, like this, like this. Stretch out. Take a deep breath in. Now, when you go the next time, you breathe out with laughter like this. Take a deep breath in. Laughter. Laughter from your belly. So stretch the hands like this. Stretch. Take a deep breath in. So first few minutes we do stretching. I usually stand up and you can't see it, but you bend down. You start with your head, you bend down, your knees are stretched, and do some marching. So just kind of do some, just like what you do before you do the exercise. So the second part is a clapping, chanting, and ha ha ho ho ho, ha ha ho ho ho, ha ha ho ho. So when we do that, as I mentioned, you have eye contact. You kind of move a little bit like you're dancing and just having a great time of your life. Forget who you are. I know you are a very important person at TMZ Seniors. Today you're a child. So no inhibition. Just have fun. So we go like this. Ha ha ho ho ho. 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 Ha ha And then we have a cheer. The cheer is very good, very good. Hey! Very good,
Good.
very good. Hey! How are you feeling?
Good. I had somebody has commented that they actually need to laugh more often. Can you tell us, Dr. Sethi, what I had a question come in asking, do you recommend that people maybe do laughter therapy every day or just when you're feeling stressed? What would be your recommendation?
So I do every day. And it won't hurt you laugh. So I do every day. Whenever I feel a little bit, sad, I just laugh. And actually, I used to do with the nurses in ICU or in the ward when they're stressed out. I'll take them to nursing in their break room, and we'll just laugh for a few minutes. In the car, when I will show you one exercise which I do in the car sometime. So you can do it anytime. You don't have to wait till you get depressed or not feeling good. If you do in the morning, you will find that the whole day will be a happy day. And the effect of laughter, especially on the immune system, lasts for 24 hours. This has been shown by a group from Loma Linda.
Wonderful. Yeah. So really, this is a great tool to keep in your back pocket that everybody should be doing. And I know that, sometimes when we have these serious situations, just having something that you can sort of help yourself, maybe through some laughter, can really do a lot of good for somebody as well. I've always found that you need to have some sort of humor in your.
That's right, and
some laughter.
You're not laughing at other person. You're laughing at yourself, and this relieves you. I think there's a difference. Laughter at other person is bad, but laughter this is good for you.
Right.
So should we start some laughter exercises?
Sure.
All right. The first one is a zoom lens laughter. You know what that is? Yeah, the zoom nowadays. So here it is. Put your fingers on. So then you go ha ha ho 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 ha ha ho 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 ha ha ho ho ho. So this gives you laughter. Then with this clapping, it stimulates your internal organs.
So
your heart rate will go up, your oxygenation will go up, and your immune system will go up, and all those good hormones in the brain, the dopamine, everything will go up, and you'll feel good.
So maybe we need to start every Zoom meeting with a little laughter exercise now, because I know we're all tired our eyes get tired on Zoom and whatnot. So maybe that'll help us.
Yeah, so when you're in Zoom meeting, be careful with whom you're Zoom meeting with.
Yes.
Zoom laughter. So second is the antenna laughter. The antennas on the brain. So now we are getting some good vibes from everyone. So we are getting some good vibes from all the participants. They are sending the blessings and making us feel good. And we are doing the same to them. We are sending our blessings, our good wishes to them for them to stay safe and healthy. So third one is a telephone laughter, which I use very often. So this pretend you've got a cell phone and the person on the other side is telling you the best joke you've ever heard in your life. And you just laugh on the joke. Joke is good. Ho, ho, ho. Ho, ho, ho. Very good. Very good. Hey. Very good. Very good. Hey. We'll do a couple of more exercises. I think we have time. Maya, let me know when we need to stop.
Yes, actually, I had another question that just came in that I'm hoping you can answer. When was laughter first found to be therapeutic?
So, in Veda 5,000 years ago, they talked about Hatha Yoga is good for you. Then, of course, in Bible, it mentions that. But I think it was in the recent history during when there was a polio in early 1900, and Shriners used to go to the people's houses, and they used to put the patients in the basement because they were they didn't feel good about them. They were shameful that they have a patient with polio. So Shriners used to go there and make the patients laugh.
Okay.
So I think that was the first time where the laughter was used to make the people laugh. Then in 1960s, some work was done at Stanford, but more than that, at UCLA, uh, uh, Norman Cousins, who got very sick, almost was dying, and he asked his doctor, "How long do I have to live?" He said, 50% of the people with this problem, they die within 6 months. And he said, let me check out of the hospital. And he treated himself with laughter and vitamin C and wrote a book on that, Anatomy of an Illness. And then there's a movie of that too. And then, of course, you know about Robin's picture on one of the guys, I've forgotten the name of the institute in Virginia. And then in 1995, Dr. Kataria started popularized the laughter yoga.
Okay,
So
great.
it's a pretty recently, but people are talking about laughter for the last thousands of years.
Right. And there isn't a place that you can, is there some place here in Tucson that if somebody was interested in learning more about laughter yoga, is there a program right now? I know that you had been through a program at one point in time, but is there a program that's currently operating that shares more about laughter yoga therapy?
In Tucson, so there are thousands of laughter clubs all over the world. In Tucson, there are 2 or 3 active laughter clubs. And one of them is in the church on Campbell and River. There's a church there. They do laughter yoga there. And I think if you Google laughter yoga in Tucson, you'll find where they are doing it.
So there's some clubs around town that you might be able to join.
That's right.
If you wanted to do it with a group. And I know usually when you come, Dr. Sethi, we have usually about 80 people in a room who are all practicing laughter yoga together, which is quite fun. So we always enjoy that.
Yeah. But this the laughter yoga you can do alone. You can do with your friends. I can just call you up and say, Maya, let's do some laughter yoga together. And you pick up the phone, and I pick up the phone, and just started laughing. So Dr. Kataria, who is in India right now, and who started the laughter yoga clubs. So when he calls me, I call him. For first 4 or 5 minutes, we don't talk. We just go, and then we say hello. Actually, we don't say hello. We just say,
So definitely a great tool that people can use at home now, particularly during this time of isolation, where they can just pick up the phone and call a friend. Just like what you mentioned, they don't have to be anywhere in town. It could just be something that, if you want to try to do it with somebody, you could do it that way. You could certainly do it over Zoom as well, as we know, right?
So, how do you you could do alone, which I do very often. Like when I'm stopping at the red light and I'm in a hurry, I want to go and I'm getting stressed out. I just say, you go like this, and I say, the car next car wonders what's going on with this guy. Can you please share the joke with me?
That's wonderful.
So the next one is the lassi or milkshake laughter. So in this one, you take 2 glasses, one higher, one lower, and go like this. A, this is the milkshake laughter.
Okay.
We'll do one more time. Are you having fun?
Yes, absolutely.
So, if you're having too much fun, I am in a mood for some argument. This is the argument laughter. But after the argument, we always forgive. So this is the forgive laughter. Very good. Very good. Hey. Very good. Very good. Hey. So, there are many exercises like this. You can just keep on creating them. You can, and, so you can do about 10 or 20 minutes. If you do this thing, you will find that your mood is completely changed. Your pain is gone. You're in a happy place, and you are not taking any medicine at all. You're just, your heart rate has gone up, your oxygenation has gone up, and it doesn't cost any money. You don't have to wear special clothes for this thing. You don't have to go to gym or beach or anywhere. You can be anywhere. You can do alone, with friends, in a group. And I think it's something which we all should be doing to help ourselves, especially during this period of pandemic when we are so much isolated.
Absolutely.
And trust me, it will help you.
Thank you. Thank you so much. Thank you so much for the advice. So I did have somebody ask whether we would have this on our YouTube. And yes, it will be, we will have this, and we'll be sharing the link out to our TMC for seniors afterwards as well. What are the changes in the brain from laughter that you're aware of, Dr. Sethi? That was another question that just came in.
So a couple of things, so it increases the dopamine level in the blood, which makes people happy. Serotonin goes up. There is some evidence that new nerve fibers might be developed in brain, though it's a borderline. So there is a waves in the brain, alpha. There's a special delta brain wave, which makes people calm and happy. And the people who meditate a lot, they develop this special brain wave. So when people meditate, so there's a data to suggest that it does a chemical as well as physiological changes in brain.
Great. Okay. Well, thank you. So I think that wraps up all the questions that I have for today. I want to thank you for being here and sharing all of your exercises, all of our laughter today that we got out. would you want to end with one last exercise or just a final exercise before we close out for today?
So I'd like to end with a couple of minutes of meditation. I would like for everyone to sit down, put their feet on the ground, close your eyes, and breathe slow and deep without judgment. Breathe from your nose and feel the air going through your nose to your windpipe, to your lungs. And breathe out. Feel the air coming out of your lungs through your windpipe, out of your nose. And have a smile on your face. Be happy. Breathe in and out. And as you breathe in happy thoughts. And when you breathe out all the frustrations, the anger, and if you have got a special area in your body which is hurting you, when you breathe in, take this breath to that area. And you will feel after a certain time that your pain in that area will become less. Breathe in and breathe out. Pay attention to your breath and be in the moment. And know how fortunate we are to be alive, happy, and have this fellowship today and learn something new. And I personally want to thank Maya and TMC for arranging this. And at your own time, open your eyes, look around, and give a big last laugh. Thank you, folks.
Thank you so much. I love having you here and sharing this, and I hope that everyone goes home or is at home and is able to do a little bit of laughter yoga. So thank you for being here, and I hope that we get to see you, everybody, tomorrow. Tomorrow, we're actually going to be, our talk is going to be on coping with social isolation during COVID. And that will be at 1 p.m. tomorrow afternoon with Zacharias Knickerbocker. And thank you, Dr. Sethi, for being here today.
Thank you very much. Have a good day and be safe.
Thank you.
Thank you.